Hi, welcome to my channel, Rohit Speaks. And in today's video, I'm going to talk about a very common skin disorder we find all around the world. And most people kind of tend to get confused what it is and which one are we suffering from. So I was just trying to make this a simple explanation. What is the difference between these two skin disorders? So the two disorders are psoriasis and eczema. So the both of them are nothing but skin disorder, and it's usually caused by your immune system. And I'll explain that more, but just to show you the common differences, eczema is usually caused by redness of your skin. If it will look something like that, where you have redness of your skin, and this is due to just inflammation. Your immune system is attacking in your skin cells, and it's usually by a sensitivity or hypersensitivity caused by immunoglobulin E. You don't need to know that much specific, but it's caused by IgE or immunoglobulin E, which is a antibody response when it comes to an allergic reaction. And that could be to anything. It could be to dust, to mites, to your clothes you're wearing or something you're eating, and that would show up usually under your skin. And they look something like redness of your skin and that. But psoriasis, on the other hand, is a little bit more complicated because in this case, you're autoimmune. It's not just immunoglobulin. So immune system is made up of five antibodies. Simply to remember, it is gamed, G-A-M-E-D, gamed. So I'm immunoglobulin G-A-M-E-D. E is for hypersensitivity. That is what is causing eczema. But G-A-M-E-D, all of them, they all are all around your body. Besides that, there are T cells and B cells. So T cells are the ones which causes the psoriasis. In this case, you won't see much redness, but what will happen is your skin starts to grow abnormally and you will see a flaky skin, which will look something like whitish around it. It will look like it's dried up. It looks like a skin which has scales, like a snake scale, which is coming out. It will look something like whitish and you will see something like that. So these are the two differences between how to identify if you have eczema or psoriasis. Sometimes your psoriasis might look like an eczema because the whiteness has not formed yet. So under the microscope, if the doctor takes a small skin of you and puts it under the microscope, an eczema skin will look something like this, where you have your normal skin looks like that, where you have hair follicle, epidermis, keratin layer, and that's your dermis and your fat. Leave it. But there will be like a phlegm inflammation here, which is more really red, and this area will be like, so this keratin layer will be a little bit bigger. This is normal. In psoriasis, what will happen is this keratin layer keeps growing. So you see normal, it is very thin, but in psoriasis, they will grow up normally, and at the one which is facing outside the environment will turn flaky and turn white. And that is psoriasis. So if they look at under the microscope, they can tell if you have eczema or psoriasis. Now, the what are the causes? As I explained, eczema is usually mostly like an allergic reaction. It's the immunoglobulin E, and it could be dust, pet hairs, mold, whatever it is, dairy products you're allergic to, your wheat products you're allergic to. That might lead to skin triggers, and you'll keep itching, and you have those itchy skin. That is mostly causes is the causative agent of eczema. But psoriasis is a little bit complicated. It might be chronic pains, which is happening over a period of time. It could be some small infection. You're consuming too many alcohol very repeatedly. That could lead to that. And you might not see psoriasis everywhere. You might see it around the area of the skin, under the skin folds, on those areas. Alcohol, smoking, skin trauma, and also eczema and psoriasis sometimes is also caused by stress. So there are several reasons which would cause all of this. And the treatment for most of the eczema is an ointment which you need, which has ceramides in it, which can actually soothe out your keratin layer. And then it just slowly brings that redness down. Anti-inflammatory ceramide cream, something like that, should help you with eczema. And also controlling, knowing what is allergic to you is also, so knowledge is always important, like why is it causing you, and then slowly bring cut down whatever it is there. Mostly lotions work, and if it is very like you have so many area where you're getting eczemic, like you have everywhere, then you might need to go for some immunodeficient or immunosuppressant medications. For psoriasis, there have been several medications on the market. Mostly are like injections you can take every other month or every 2 months, and you don't need to take it very too often. Some psoriasis which are smaller in small areas can be done with phototherapy by injecting you or not injecting but subjecting them to UV light, and that could take care, or putting some liquid nitrogen and just freezing up that whole keratin layer and it just comes off. But again, for psoriasis and eczema, please consult your dermatologist and they will know what to do, or what kind of medication you need, or based on how many area you have eczema and psoriasis, you need to consult your dermatologist. I recommend highly, if you see psoriasis or eczema in smaller areas or larger areas, please go to a dermatologist and get yourself diagnosed and get some kind of medication or cream. And if you have eczema, try to do an allergy profile for you so you know what are you allergic to so you can reduce that over the period of time. So hopefully with this video, you get to understand what is the difference between psoriasis and eczema. Both of them cause itchiness. You will feel a strange urge of itching them, and you might itch them till the point that you drop blood. So that's not nice. Make sure you know what it is. You might put some lotion to calm it down, but definitely consult your dermatologist. So with that, I would switch off this video, or I'll log off this video, and I'll see you on the other one. Thank you.